An enlarged prostate can cause a lot of discomfort and frequent urination for men who suffer. Now, a new outpatient procedure that uses laser vaporization may mean a quicker recovery with little discomfort and no sexual side effects. We spoke with Dr. Stephen Auerbach at Hoag Memorial Hospital Presbyterian in Newport Beach to find out more.
Prostate cancer is where there's abnormal growth of prostate tissue, and there's actually cancer cells that causes enlargement of the prostate, and it's a growth of these tissues. An enlarged prostate is not a precursor to cancer. What happens is men can develop prostate cancer cells, and this is most common in men after the age of 50, and they should be checked once a year with screening with a digital rectal exam and a PSA, which is a blood test. For African American men, they should be checked at 40 years of age because they have twice the incidence of prostate cancer. But the exact size of prostate does not mean a man's going to have prostate cancer. The treatment of enlarged prostate, first of all, is avoiding certain foods like caffeine. Spicy foods may cause a man to urinate more frequently. Then we can treat this medically with medications called alpha blockers, and these are medicines that relax the smooth muscle in the prostate, allowing a relief of the symptoms. Sometimes there are medicines also to shrink the prostate, and that will help to improve urinary symptoms. Now, if all of this fails, there can be the need for a surgical intervention. And standardly, we've used what's called transurethral resection of the prostate. It's called TURP, more commonly known as Roto-Rooter for most men. There's a new technology called green light laser vaporization of the prostate. And this can be done as an outpatient. It can be done even under local anesthesia with IV sedation. The green light laser is a new technology that utilizes an 80-watt laser beam. And what this does, it has very high energy that is applied to the prostate. And this can be done under local anesthetic. There's very little bleeding, very little post-operative symptoms. And most patients do very well with this if chosen correctly. And instead of cutting across the tissue, as we did with the standard TURP, this actually shines the laser onto the tissue, and there's blood vessels on the tissue that attract this laser light. And so it heats up and actually turns it to smoke. It vaporizes the tissue. And so patients can get back to work within a few days. There's a much quicker recovery time. During the procedure, a patient will not feel anything. Post-operatively, they can have a little bit of discomfort, such as urgency, frequency, which would happen with any procedure, but generally it's less than with the standard TURP. One of the best advantages with the laser is that there are no sexual side effects. It does not affect erectile function. Any man who is on medication that is having symptomatic signs of prostate problems, which is the urgency, frequency, slow stream, getting up at night, and if the medicines don't work or he wants to be off of the medications, because sometimes the medicines are costly and have a number of side effects. So as men age, they will tend to then be a potential candidate for this. We've been doing this here at Hoag now for about 2 years, and there's been studies, clinical trials, which have shown this procedure to be performed over the last 5 years, and it's equaled or bettered the standard TURP. So the symptoms scores have done very well, and post-operative results have been very good.